Right. Thank you so much, Jada, and to our incredible speakers for such an informative discussion. There's definitely so much to learn today, ladies and gentlemen. Next, we explore how cutting-edge advancements in patient care, genetics, and law are pivotal in building trust and confidence. To take us through this discussion, please welcome to the stage Dr. Mourad Ghrairi, the Chief Medical Officer at HMS FIFA Medical Center of Excellence, Dubai. Along with him is Dr. Ibrahim Mashreky, a specialist in human tissue development and genetic engineering. And Chrissie, Wolfe, a founder of the lab consultancy law firm, and your moderator, Miracle Nassif, a professional athlete and women's fitness expert.
Just عندها please. Okay, شكرا.
After learn, hello, you hear me? After learning a lot about medical tourism, it's time to learn more about elevating the trust through safe and satisfying medical experience. In this panel, we're going to talk about how patient care, genetics, and law are pivotal in building trust through safe medical experience that redefine care. Please help me in greeting my guests. Dr. Mourad Ghrairi, Chief Medical Officer, HMS FIFA Medical Center of Excellence, Dubai. Dr. Ibrahim Mashreky, Specialist in Human Tissue Development and Genetic Engineering. Ms. Chrissie, Wolfe, Founder, Lab Consultancy Law Firm. Let me start with Dr. Mourad. What strategies does HMS FIFA Medical Center use to build trust and quality of your services?
Thank you so much for inviting me. I'd love to say hello to my friends over here. And we, as a medical center of excellence, we have many, we have to keep our accreditation. It's mainly from FIFA, the Football Association, and the National Football Association, and the AFC, the Asian Football Confederation, and the JCI as well as a group, and very soon the IOC, the National Olympic Committee. So basically we take care about not only the athletes, but the normal population as well, but it's based on high level requirements, standard of care, and it's basically with the well-trained staff. We always keep well-trained our staff, and also as per the requirements of the accreditation, we need to be up to date in terms of research as well. So every year we need to publish one paper at least related to how to improve, how to help the players to improve their health and basically their performance. And when it comes to the performance, there is a lot of new technology, and the technology in terms of treatment, a lot of innovations, surgeries, ACR reconstructions, and also when it comes to the most common injury, which is the muscle injury in athlete. And the second aspect of the innovation is the assessment and the enhancement of the performance.
Beautiful. And Dr. Ibrahim, so with Dubai being the hub of medical tourism, how advanced treatment like genetic engineering and tissue development elevate trust among the international patients?
Yeah, first of all, I would like to thank you. Actually, it's a matter of reputation for innovation. When we talk about Dubai not only leader in MENA region, but also international level. All medical and research centers here in Dubai are following international standards that affect positively an overall experience for patients. We are talking about assuring a high cure rate and success rate for any medical procedures in genetic engineering and biotechnology, plus the issue of gaining their trust. to choose Dubai as their destination for medical tourism, and this is what's happening right now. Dubai now one of the best countries ever and city ever for medical tourism, plus to be able to build the trust with patients because you are following every guideline related in this domain.
Yeah. So with medical part being covered, now comes the law. Can you tell me more, please, about the specific, if there's a specific regulation that impact the trust of and satisfaction of patients when they come to the UAE as medical tourists?
Thank you. It's a pleasure to be here and to see so many of you in the audience. As you say, I bring the law aspect. I'm a specialist lawyer. I've been representing clients in respect of medical tourism cases for over a decade now, including claims in over 20 different jurisdictions. And as the lawyer on the panel, I have to say the answer to your question, it depends. It depends on the jurisdiction that we're in, because the regulations actually differ across the Middle East, because the Middle East actually has a number of different legal jurisdictions within it, and the regulations are different depending on the jurisdiction. Also, interestingly, in the cases of medical tourism, where patients have traveled in from other countries to the Middle East or to the UAE, they may also have some regulations to protect them from their home countries. So really it does depend on where they've come from and where they are having the procedure. However, what I can say in a general term is that across the UAE, medical licensing is very strict. So in order for doctors to practice here, they have to go through a very rigorous examination process and qualification process in order to be registered as doctors and be allowed to practice here, which actually is not the same across all jurisdictions across the world. In fact, it's not the case that in every single jurisdiction that you go to, that every single person performing a medical or cosmetic procedure will actually be properly regulated and properly licensed, whereas across the UAE, patients can feel safe that the person they are going to for their medical procedures has had a very, very rigorous test in order to be in that position.
Now I feel safe. Dr. Mourad, can you tell us more about the technology that used in the center, and if there is specific innovation that really help patient trust these days?
Yes. Thank you for the question. It's very interesting, especially the trend right now with the new technology in terms of how we can help the player, not only to improve his performance, and especially to prevent injuries and to prevent, sickness. And it's basically the big progress of biomechanics. So yourself as a former athlete, you know what it does mean. It's very important to analyze all movement of the player related to his sports practice. Then we take it from there to advise him to correct any kind of disbalance in his body, and this is potentially a source of injury. Then it will affect negatively his performance. This is the first aspect. The second aspect is to monitor the training and the performance, especially with the wearable technology. We know the player, how he trained, how he performed, how he ate, how he slept. So based on that, that big data, sometimes it's a bit difficult to know exactly, because it's a huge data. We are facing a huge data, and this is another problem. Maybe the lawyers, they will help us to understand these kind of issues. And it's really specific for each player. It's tailored for each player, for each high-level athlete, to help him because to perform well, it's not only a matter of to train well. There are many other factors around, and the prevention right now, the impact of the new technology in the field of the prevention, it's very important, and I think this is what it will help the player to perform better and better.
Of course, and now we see it actually in the longevity of athletes. Like back in the day, someone would get injured and they stay home. It's not anymore. They actually, with all the injury prevention, then recovery after surgeries and after normal injuries, of course, we can see athletes staying longer. Look at Federer, when did he quit?
And we have to take into consideration kind of contradiction. how to help the player to get back the soonest, at the same time, how to keep him away from the re-injury. And this is the main problem. If one player, he was out of his job for 6, 7, 8 months of cruciate ligament reconstruction surgery, if he will be back soon, he'll be back early, if he'll not be okay, then he will get again the same injury, then sometimes it's a disaster for his career.
They used to teach us that the best way to prevent, to actually recover from an injury is to prevent it.
Exactly.
So, yeah. And so, Dr. Ibrahim, how can we ensure the highest standards in advanced treatments?
Yes. Back again, everything is special, everything different in Dubai and in UAE. I can say 4 main points. First of all, because of international collaboration of international bodies here, I mean Food and Drug Administration and WHO, World Health Organization. Number 2, in Dubai and every medical center, they are strictly attached to the guideline of Dubai Health Authority,
yes,
which is also really important. Number 3, I can say the code of ethics. You know, in our domain, I mean genetic engineering and embryology and IVF, to be strict to the code of ethics is really important. And this, definitely, we can find it here. Plus, something really special also in Dubai, it's a matter of post-treatment diagnosis, that they keep following up with patients even after completion their treatment. Why this will affect positively in so many circumstances. First of all, for quality control, to keep developing the procedures and medical procedure, especially in genetic engineering and biotechnology, which is continuously developing. Number 2, to be sure that you are reaching the level of satisfaction for your patients. Plus, for the coming patients and coming techniques that we're gonna develop, this feedback is really important for us to keep developing what we are doing. That's why Dubai is the best ever place for medical tourism.
And it's because also you keep innovating new things, so people come back and they try new things and they leverage from the high tech of genetics development. So, Ms. Wolfe, so what if, have you seen like any cases that happened that actually the law firm had to interfere and resolve this? And how did resolving these issues actually build trust in the entire healthcare system?
Yes, so thankfully the medical system across the UAE is incredibly robust, actually. So complaints and legal issues are rare. In the vast majority of cases, patients are very, very happy with the medical care that they have received. And if there are any issues, they can be resolved directly with the practitioner. In the cases where things go wrong, then where the lawyers get involved, that's an incredibly important part of the process to ensure that patients feel safe. It's very similar, in fact, to the criminal justice system. So, hands up if you feel safe walking around in the UAE. Do you feel safe?
Obviously.
Yes.
Do you?
You feel safe. And you feel safe because you know that there is a very robust system of law enforcement. So when people do things wrong and they break the rules, there are consequences for that. And we must do the same for patients in order for patients to feel really safe coming to the UAE for treatment. And the regulators who provide that framework and the lawyers who bring those cases in situations where there has been a very serious failure on behalf of the medical professional, that ensures that level of safety and really makes sure that there is a deterrent for medical professionals not to get things very, very badly wrong. So it's incredibly important. There are a number of cases that I've been involved in multiple jurisdictions going through the courts, actually. And all of those cases, in each situation, it has resulted in a very significant change to the regulations or the laws, which has helped to protect patients. And those cases do need to publicly go through the courts in order for those changes to happen. So it's a positive thing for the medical profession and for patients to make sure that those cases do come about in those serious cases where things go wrong.
I now feel safe. I don't know, I told Dr. Mourad, I come from a family of doctors. Usually people used to fly out to get the best medical education and treatment. My feel is that everyone will going to come to Dubai.
Yes.
For both not only the treatment, but also the education of the very, very high standards. Thank you so much.
Thank you. You're welcome.
You're welcome.
Thank you so much.
Thank you.
That was great.
Thank you.
So much. Thank you.